Hey, it's Scott. And in this week's Give Me Five, I'm joined with Wendy from the Florida Poison Control Centers. And what we're going to go ahead and quickly touch on is the whole idea of look-alike poisons.
So today we're here actually at a disaster management conference with a lot of hospital professionals sort of preparing to respond to poisonings. And one of the things we see even on a normal day is confusion about different products that have similar color, shape, size, etc. But we see this especially after storms, right? When the power goes out, people are disrupted. They may be combined in multiple families into a house. Maybe they're in a shelter situation. And so what we'll see is, people just getting discombobulated and getting confused and poisoned. So we have two examples here. So for children, the big concern is that pills and candy look very, very similar. And I think families don't realize how similar and how attractive a medication can be until a child gets a mouthful and families are just really shocked. So, if somebody is displaced to a shelter or if they're staying with relatives, they may have taken their medicines out of a child-resistant container that, it comes from that nice safe container from the pharmacy. They may have opened it up, put it in a pill minder, or even a Ziploc bag, right, for convenience. And unfortunately, it's now available to children. So we have this display here. This is our most photographed display when we're out in the community and doing events like this, where people are just reminded of how attractive these things are, right? They're small, they're colorful, they're sugar-coated in many cases. And down at the bottom, you actually see the gummy form, right? And so we now see a lot of medicines, including very powerful medicines like, things with tetrahydrocannabinol, in them, melatonin, these other things. Even vitamins have the potential for harm if they're eaten by the handful, right? So we like to show this to parents and grandparents so that they have a sense of why they need to keep their medications secure, even if they are on the go or displaced. This is another example too. Sometimes in our desire to toss out a big empty container or something, people will reuse food containers for poisons. This is another really popular display that we use both in the community and sometimes in schools when we go in to talk about poisoning with children. I like to have them guess, which one is the deadly poison, and usually they do guess the green. I think you did too, right?
Yeah, absolutely.
But in this case, the green is watermelon Gatorade and is an actual flavor of Gatorade. This blue one that really looks pretty yummy is actually antifreeze. So that's ethylene glycol, one of our toxic alcohols. So we show these just, people are so surprised, but we see these in the poison control centers every day. It is so common. We have a checkbox in our system for, look-alike poison. And so we're there to answer questions. If anybody swallows something they shouldn't, please give us a call sooner rather than later. We do not want to wait until there are a lot of symptoms, and we can really help the provider or the family, sort of figure out what's the worst case scenario, what needs to happen.
So with these, just two quick things that I noticed. Number one, as you brought up earlier, if you've got medications, please keep them in whatever bottle they're supposed to be in. Yeah. Hopefully with a child-proof / resistant / adult can't open it cap. Because at least from what I remember reading, there's actually studies on this saying how hard adults have to work to get this thing open versus kids have no worries whatsoever. But keeping them in the thing that's hopefully quasi-locked, having a label on it so we actually know what the heck it actually might be. But then specifically for this one, keeping stuff in where it's supposed to be so that you actually know what it is. Because that's huge. Because again, I took a look and I'm like, well, you know what? If I'm at work and it's 104 degrees outside and I'm thirsty.
It looks pretty attractive.
I mean, both of these look pretty good. They're cute, they're colorful, and they're liquid.
Yeah, and there's no active ingredient here. So this really makes treating it challenging, not just for you in a healthcare setting, but for us over the phone. If we get a call, oh, I drank this stuff from a Gatorade bottle, we're not going to be able to provide the type of advice we can if there's a nice, clear label.
I mean, you truly don't know what it is.
No, you would
just
have
know
to
it's a
send
blue
somebody
liquid
in.
sitting in a Gatorade bottle, and then it comes down to, well, how does the kid look?
Absolutely. No,
and then you go through your, all right, sounds like this, doesn't sound like this, and just kind of keep going down. And
Yep. And locally people tell me, oh, this is a Hispanic thing, in the community here in Miami. And I'm like, I think pretty much everybody does this. It's convenient. Especially the Gatorade bottles have the wide mouths. People do this all the time. But, workplaces have rules against it. But at home, we do kind of whatever we want. And unfortunately, that is where we see a lot of the poisonings.
So keep them away from children. Don't put them in Gatorade bottles.
Yep. And call the Poison Center if you're dealing with any type of poisoning. We can help you, walk you through what to do, and then we will actually follow up that case until discharge to make sure that things are on track.
Thanks so much, and as always, we'll see you next week in our Give Me 5.